I would now like to introduce the San Antonio Chamber of Commerce President and CEO, Richard Perez.
Thank you, Jeff. Good afternoon, everyone. Thank you for joining us today. And by the way, Dr. Kurian, we're almost at 100 strong, so clearly there's a lot of interest in what you want to talk about today. It's on the top of everybody's mind, and so I'm really excited to be able to host today's webinar, A Safe and Healthy Return to Work. San Antonio Chamber of Commerce, together with our partners, we're just extremely proud to host this free webinar to get businesses back to work and employees back into the office. And of course, we want to do this safely, and that's the key. That is the key. As COVID cases in San Antonio continue to drop and the number of vaccinated San Antonians continues to grow, many businesses are anxious to get remote employees back in the office. At the same time, business owners and leaders need information on how to safely and practically return to work and begin our regional economic recovery in earnest. As I said, I'm looking forward to today's discussion. You all will have the opportunity to ask Dr. Kurian questions. And as you all know, she is one of the leaders, a leader in this community, and we see her almost nightly on the news, and she's just a voice of confidence and reason. And so with that, I'd like to introduce Dr. Kurian. She is the Assistant Director of the San Antonio Metropolitan Health District and leads the activities of the Communicable Diseases Division, which includes epidemiology, the immunizations programs that we have, STD and HIV clinics, tuberculosis clinics, and laboratory services. As head of the Communicable Diseases Division, she leads Bexar County's epidemiological and public health response to the COVID-19 pandemic. She has over 17 years of extensive local public health experience and has previously served as the Associate Director at Tarrant County Public Health and the Chief Epidemiologist for Tarrant County, during which time she led numerous local and statewide infectious disease outbreak investigations. She has a medical degree from India, an MPH in epidemiology from Emory University, and a doctoral degree in clinical research from the University of North Texas Health Science Center. Her focuses of interest include infectious diseases, population health, health informatics, and community and stakeholder engagement. Dr. Kurian, I am so pleased that you're here. We're looking very much forward to hearing you, and then of course, doing the questions and answers at the end. So with that, I will turn the stage over to you, and again, welcome.
Thank you, Mr. Perez, and thank you, Mr. Fair. Really excited to be here, and I hope you find this session to be useful and informational. So Andrew is going to help me move forward in this slide presentation. So as businesses and employers, you know this, you already play a key role in preventing and slowing the spread of COVID-19 in workplace. And you can do this foremost by coordinating with us, your local public health department officials, and the department itself to obtain timely and accurate information to inform appropriate responses in your workplace. The local conditions in the community influence the decisions that we as public health officials make regarding community level strategies that we recommend or implement. So having said that, next slide, please. Let's look at what the local conditions are with regards to COVID-19 in our community. Let's start with that, right? So as far as the cases go, we crossed the 200,000 case mark last week. So currently we are reporting 208,172 cases of COVID-19 in Bexar County with 3,212 deaths. Approximately 20% of the deaths that we report, we typically document that in congregate settings. It's your nursing homes or your long-term care facilities, your assisted living facilities. Approximately 1 in 5 cases are asymptomatic, meaning they do not exhibit any symptoms. And our 7-day moving average that you see up there, it's 178. It's been steady for over a month now, anywhere between 170 to 150 to 250 is the range we are seeing. And approximately 99% of our cases at this time are estimated to have been recovered. Next slide, please. So what you see up here is the COVID-19 community-wide risk levels. We use several progress and warning indicators, which are shown at the bottom of the slide there, to determine the COVID-19 risk levels for Bexar County on a weekly basis. And all these indicators, like I mentioned earlier, all these indicators have been in a downward trajectory for about a month now. So our current COVID-19 community risk level at this time is low. Even though the COVID-19 risk level is low, we continue recommending public health preventive measures that are proven to prevent the spread of COVID-19, such as consistent masking, practicing physical distancing, frequent hand washing, and especially staying home when you're sick. Next slide, please. If you're not sure whether you are ready to resume or reopen your business, this toolkit that you see up there, the Resuming Business Toolkit by CDC, it's a great decision tool to use as a start. Now, it is designed to assist employers such as yourself in slowing the spread of COVID-19 and lowering the impact of COVID-19 in your workplace. This toolkit provides checklists to prepare the workplace for operations and a tool to navigate protective options for workers. The Restart Readiness Checklist, it pertains to preventing and reducing transmission among employees, maintaining healthy business operations, and maintaining a healthy work environment. The Work Protection Tool, it provides you with a wide array of protective measures and based on the nature of your employees' interactions with other workers and or the public itself, you could consider, it offers you multiple options. So you can consider whether these multiple options included in this toolkit apply to your business and then work through these items as you go along. The Resuming Business Toolkit also includes returning to work infographics that could be shared with your employees, and depending on your business, consider printing and posting this in common areas such as your break rooms, your meeting rooms, conference rooms, hallways, elevators, bathrooms, good place to post these infographics. You could also email to employees, encouraging them to print a copy and place it to where they will see it, often in their office or workspace. You could read the content of these infographics or preventive measures included in the infographics repeatedly in your team meetings. Remind employees to reach out with any questions, have a point of contact where they can send in all their questions. Next slide, please. So as of Monday, March 29, 2021, you must have already seen this in the news. Everyone 16 years and older is now eligible to receive a COVID-19 vaccine here in the state of Texas. And this toolkit, the CDC's COVID-19 vaccination toolkit, is another important toolkit that has various tools to communicate the importance of vaccination or just the strategies that you might implement with regards to vaccination to your employees. It has good information on general COVID-19 vaccines, raising awareness on how to raise awareness about benefits of vaccinations among your employees and address common questions and concerns that your employees might have. Next slide, please. So as I mentioned, the COVID-19 toolkit, it gives employers tips on various preventive tools, including how to promote vaccination within your own workplace, your businesses. And it includes key messages that could be adapted to the language, tone, and format that will resonate within your organization and among your employees, because you know what works for your employees. This toolkit also has template letters that could be customized and sent to your employees to introduce COVID-19 vaccine educational activities in your workplace or in the community itself. It also has various communication resources such as posters, slide decks that could be used as handouts or to hang in highly visible places in your offices, buildings, and other employee locations. So we strongly, in addition to all this, we strongly recommend having open discussions creating and publicizing feedback mechanisms for your employees to ask questions that I mentioned already about COVID-19 vaccinations, have an email inbox, a phone number, or point of contact for this. And if you need any assistance with any of this, you can always reach out to us, your local public health officials. Next slide, please. Here's one of the key messages that are included in the COVID-19 vaccine toolkits, which is letting the staff and the employees know that each one of them can help stop the pandemic. Now, stopping a pandemic requires using all the tools we have available. So wearing a mask, physical distancing help reduce your chance of being exposed to the virus and spreading it to others. But these measures are not enough. Vaccines are another key tool that we have in our toolbox to put an end to this pandemic. Vaccines will work with your immune system, so it'll be ready to fight the virus if you're exposed to them. So preventive measures such as masking and physical distancing that we've been recommending help reduce your chances of being exposed to the virus. But the vaccine helps you fight the virus should you be exposed to it. So you need all these tools in your toolkit to fight this pandemic successfully. The more people who get vaccinated, the more we can get back to normal activities and open more places safely. And the vaccines at this time, just want to mention this, vaccines are voluntary for the general public. So you as employers can consider encouraging rather than requiring your employees, especially before the final FDA approval. So currently all vaccines that are in use are not FDA approved, but they have an emergency use authorization under the FDA. So we recommend that you strongly encourage, not require your employees, but should you require and should employer mandates come into existence, you must include or consider including medical and religious exemptions for vaccinations in your mandates. Next slide, please. The next key message is that COVID-19 vaccines are safe and effective. So COVID-19 vaccines are evaluated in tens and thousands of participants in clinical trials. The vaccines have met rigorous FDA scientific standards for safety, effectiveness, and manufacturing quality. Millions of people in the United States have already received the COVID-19 vaccine. So these vaccines have undergone the most intense safety monitoring in history, in our nation's history, and they are deemed to be safe and effective. Now, one of the common myths I encounter is that COVID-19 vaccine can make you sick with COVID-19. I just want to say this loud and clear here. None of the authorized and recommended COVID-19 vaccines contain the live virus that causes COVID-19. This means that COVID-19 vaccine cannot make you sick with COVID-19. Now, all COVID-19 vaccines teach our immune systems how to recognize and fight the virus that causes COVID-19. Now, sometimes this process can cause symptoms such as fever, and these symptoms are normal, and all it indicates is that our body is building immunity against the virus that causes COVID-19 in response to this vaccine. Now, it typically takes a few weeks for the body to build the immunity or protection against the virus that causes COVID-19 after vaccination. So that means that it's possible a person could be infected with the virus that causes COVID-19 just before or after vaccination and can still get sick. That still does not mean that it's the vaccination that resulted in that person getting COVID-19. So it typically takes about 2 weeks after you're fully vaccinated to be protected against contracting this infection. The other thing I want to point out is that allergies to egg is not one of the reasons that you should stop from getting this vaccine. The vaccines, the Pfizer and the Moderna vaccines are mRNA vaccines. They do not contain eggs. They do not contain pork. They do not contain gelatin, latex, or preservative. What's in the mRNA vaccine is the mRNA itself, the lipids, or the fat coating, and polysorbate sugar that prevents the bunching up of these ingredients in the vaccine itself, and several pH buffers. So If you're allergic to any of the ingredients that's listed up here, then that's one of the reasons that you don't take the vaccine. But allergy to egg, pork, latex is not one of the reasons you stop yourself from getting this vaccine at this time. Next slide, please. So the other the other key message that's included in the toolkit, or that you can widely publicize in your workplace, is that the vaccine, you may experience side effects as a result of the vaccines. And like I mentioned earlier in the previous slides, these are normal signs that the body is building protection against the vaccine. More than half of the people will have systemic side effects with second dose, such as fever or generalized body ache, and you'll see that in the next slide. So our recommendation is to avoid worker shortages. You can have your employees staggered to receive the vaccine. So not everybody get the second doses, and not everybody is out as a result of experiencing side effects at one time. Employees who develop fever should stay home, should be excluded and stay home, and should get back to work once they are fever-free for at least 24 hours without any fever-reducing medication. Next slide, please. So these are the side effects that I was mentioning earlier. Here are some of the common side effects you experience once you get a shot: is pain and swelling around the injection site. You may also experience fever, chills, tiredness, headache, just generalized, weakness. So all it means when you experience these effects, all it means is the vaccine is working. And typically these side effects begin within 1 to 3 days after vaccination and resolves within 24 to 48 hours. Now, if the redness and the swelling or the pain at the injection site gets worse after 24 hours, or if you see side effects that are worrying and they don't seem to resolve within 24 to 48 hours, we recommend you seek medical attention or call your healthcare provider for further guidance. Severe allergies are sometimes, not often, but pretty rare, are also associated with these vaccines. And typically, like I said, these are rare. We tend to see them in about 4 or 5 cases per million. And an allergic reaction, we consider a reaction to be an allergic reaction or severe anaphylactic reaction when a person needs to be treated with epinephrine or your EpiPens, or if they have to be taken to a hospital or be hospitalized. Next slide, please. Now, if you experience symptoms like cough, shortness of breath, runny nose, sore throat, or loss of taste or smell, these are not post-vaccination. If you experience these symptoms post-vaccinations, these are not likely to be from vaccines. So what we recommend in these instances is that you exclude the person from your workplace pending evaluation, including a COVID test. And if a person then tests positive for COVID, then the person has to be excluded from work for at least 10 days from the date of onset of symptoms or the time when the person tested positive, and at least 24 hours have passed since a person has been fever-free, and you see other symptoms improving too. So these are some of the criteria. These are 3 main criteria that you have to keep in mind before you let a person who's been tested positive for COVID come back to work. Now, if you experience symptoms like fever, fatigue, headache, chills, muscle or body aches, or joint pain, like I mentioned in the previous slide, these may be side effects from vaccinations, or they also could be because of COVID infections or other infections. So our recommendation at this time is post-vaccination, if your employees or you experience any of the symptoms that's listed here, the fever, fatigue, headache, chills, muscle, body aches, joint pains, you can let the person come back to work. If the person does not have any fever, there is no history of any close contact or coming in contact with another person who's a confirmed case of COVID. So you don't have to exclude people who are experiencing regular post-vaccination side effects from work. They can come back to work as soon as their symptoms resolve. Next slide, please. So consider the other key message that we would like for you to perpetuate among your in your workplace, among your employees, is that the vaccines will be free. The vaccines are free. So you can consider hosting your workplace vaccination clinics once supplies are widely available. As employers, you may want to engage a community vaccination provider or a vendor for on-site vaccinations, or you could, encourage your employees to seek appointments at the mass vaccination hub sites that we have, and we have 4 here in our community at this time. Whether vaccination is at workplace or in the community, you as employers should allow time for vaccine confidence to grow among your employees. You must provide easy access to vaccinations for all people working at the workplace, regardless of their status as a contractor or a temporary employee, and consider offering flexible, non-punitive sick leave options like paid sick leaves for employees with signs and symptoms after vaccination, and have other supportive policies such as transportation support for an extended period of time should your employees need that to get vaccinated. Next slide, please. We know that vaccines are effective at preventing COVID-19 disease and infections, especially severe illness and death. So we recommend, or I should say, we are still learning many things about these COVID-19 vaccines. We are still learning how well COVID-19 vaccines keep people from spreading the disease. Should they get it after vaccination? Early data show that the vaccines may help people from spreading COVID-19, but we are still learning more as more and more people get vaccinated and more data becomes available to us. We are still learning how effective the vaccines are against variants of the viruses that are circulating in our community. And yes, we have documented COVID-19 variant strains circulating in our community. Early data show that the vaccines may work against some of these variants, but they could also be less effective against others. And again, we don't know much about these vaccines or how they behave in real world conditions. We are still gathering data and learning more and more each day as more and more people get vaccinated. We are still learning how long COVID-19 vaccines can protect people, or how long the immunity that is developed as a result of vaccination lasts. So until we know more about each of these questions, everyone, even those folks who are fully vaccinated, should continue to take those basic preventive messages, such as consistent masking, practicing physical distancing. Fully vaccinated people, and that's that bullet, that bolded underlined bullet. I just wanted to point, direct your attention to that. Fully vaccinated people with no COVID-like symptoms do not need to quarantine or be tested following an exposure to someone with suspected or confirmed COVID-19 at this time, as their risk of infection is considered to be very low at this time. They should, however, still monitor themselves for symptoms for COVID-19 for 14 days following the exposure. And if they experience symptoms, they should promptly isolate themselves, get tested, seek medical attention. Next slide, please. So what you see up there, and before I go into the chart you see up there, just want to define what fully vaccinated means. Right? We consider a person to be fully vaccinated 2 weeks after a second dose is given, or 2 weeks after a single dose vaccine like your J&J vaccine. So you're considered to be fully vaccinated 2 weeks after you've received your second dose of Pfizer or your second dose of Moderna, and 2 weeks after you received your Johnson & Johnson vaccine, your Johnson & Johnson or your Janssen vaccine. So what you see up there are some of the things that you can do once you become fully vaccinated. So once you are fully vaccinated, you can visit inside a home or a private setting without a mask with other fully vaccinated people of any age. You can visit a home or a private setting without a mask with one household of unvaccinated people who are not at risk of severe illness, right? So you're visiting a household that's not vaccinated, but you're fully vaccinated, but you need to make sure that the household that you're visiting do not have any people who are at high risk for infections. And these are folks who are 65 and older, folks with underlying medical conditions. Once fully vaccinated, you can travel domestically without pre or post travel test results. And that guidance just changed very recently. CDC changed that guidance. You can also travel domestically without quarantining after travel if you're fully vaccinated. And if you're fully vaccinated, you can travel internationally without a pre-travel test, depending on the destination. And I want to point out, some countries, depending on where you're traveling to, still might require that negative test results. So always check your final final destination guidelines before you make your travel arrangements. And if you're fully vaccinated, you can travel internationally without quarantining after travel. Again, this also depends upon which country is your final destination. What you cannot do, even if you're fully vaccinated, is visit indoors without a mask with people at increased risk for severe illness. What you cannot do if you're fully vaccinated at this time is attend medium or large gatherings in the community. Next slide, please. So the next two slides, I just threw in two commonly encountered questions from employers. So next slide. One is, guidelines about quarantining. Who needs to be quarantined? So people who have been in close contact with someone who has COVID-19 need to quarantine unless they've had COVID-19 within the past 90 days or 3 months, or they are fully vaccinated. Now, once you're identified as close contacts, you're recommended to quarantine for 14 days if you don't meet those two criteria, right? You've not had COVID in the past 90 days and you're not fully vaccinated, then you're recommended to quarantine for 14 days. Though the CDC guidance, CDC issued a science update about possible shorter time frames in December, CDC still endorses that 14-day quarantine time frame, and so does Metro Health at this time. You're considered to be, and before I go into that next bullet item, I just want to mention, I keep talking about quarantine. So quarantine, all quarantine means is that the term quarantine is used by public health officials when we isolate, when we keep someone who might be exposed to COVID-19 away from others. And close contact, we define close contacts as somebody who was within 6 feet of someone who had COVID-19 for a total of 15 minutes or more, or you provided care at home to someone who's sick with COVID-19, or you had a direct physical contact with someone who was positive for COVID-19, right? Like you hugged or kissed someone who had COVID-19, or you shared eating or drinking utensils with someone who was COVID-19 positive, or somebody who's COVID-19 positive sneezed, coughed, or somehow got the respiratory droplets on you. So all these criteria are looked at before we deem somebody or we classify somebody as a close contact. Now, people who have tested positive for COVID-19 within past 3 months and have recovered, like I mentioned, do not have to quarantine or get tested again, so long as they do not exhibit any new symptoms. Now, if they develop new symptoms, then you'll have to isolate them promptly and recommend that they get tested. Next slide, please. And this is the other slide, the other common testing mistake, or common issue or item or concern that we see among employers, right? These are the common testing mistakes that's usually done. So one is, you may recommend testing somebody too soon, right? So after a close contact, we recommend that you wait for at least 5 to 8 days before testing and quarantine for 14 days, even if the test is negative. So it's very important that you wait, you don't get tested immediately after the exposure happens, because by 5th day and thereafter, your chances of contracting the infection and a test being positive is much, much higher. So if you test too soon, you may end up getting a negative test. But it's very important to know, even if you get a negative test and you've been classified by us as a close contact, we will recommend that you quarantine for 14 days, even with a negative test results. The other common testing mistake that we see is that the testing is done too often, right? So I've mentioned this over and over again. If you've had a COVID infection in the past 90 days or 3 months, we do not recommend you retest yourself, because you will test positive, but testing positive doesn't mean you're still infectious, right? So you will have virus, but these viruses may not be viable to cause infection or transmit the infection to others. Then we also see folks over relying on these testings. So testing is only a part of the multi-pronged strategies. You should also continue to practice other preventive measures like physical distancing, consistent masking, avoiding large crowd gathering, staying home when sick, right? So just because you have a negative test doesn't mean you're out of the woods just yet. And then rapid tests, just want to throw this out there. There are several tests that one can use: viral test, antigen test, antibodies test. So the rapid tests are your antigen tests. They tend to be more false positive. They have more false positive and false negative results. So if you are symptomatic and your rapid antigen test is negative, we recommend that you follow it up with the gold standard test, which is your PCR, and this should be done within 48 hours if in doubt. And that pretty much ends. And I think the last slide is all the resources, and everything that you saw in the slide that you heard me talk about, it's all referenced here. So they all come from the CDC toolkits. And I want to just draw your attention to that text alerts. Residents, if you have not already opted in, if you wish to receive updates about COVID-19 vaccine appointments at all these 4 mass vaccination hubs we have currently in our community, you can opt in and you can text vaccine to 55000 or vacuna to 55000. By signing up, you will receive texts each time appointments get released at any of these mass vax websites. So I'll stop here and I'll be happy to take any questions.
All right, Dr. Kurian, thank you so much. Great job. Very content laden, a lot of facts and things that people need to think about. We'll send out, as you have said so well, the links to the toolkits. People will have access to this actual slide deck as well, so that'll help answer some questions. Of course, you all are always available at the health department with all the things that you're doing and the outreach. So let's go into a couple of questions. You talked about this earlier. Will I get COVID-19 if I get one of the vaccines?
No, like I mentioned earlier, none of the vaccines that are authorized and being used here or anywhere else in the world will give you COVID-19. These vaccines don't contain live virus.
Excellent, that's good. Straightforward and right on. The other question that's very much connected, can you get COVID-19 after you get vaccinated?
Yes, so like I mentioned in my presentation, it takes 2 weeks, at least 2 weeks after you receive your second dose to be completely vaccinated or completely protected against COVID-19, right? So if you get exposed to the virus anytime just before you're fully vaccinated or just before you get your first or second doses, there is a likelihood that you can get COVID-19 because your body has not built up that immunity or protection against COVID-19 completely. Now, even fully vaccinated, these vaccines, nothing is 100% guaranteed, right? So these vaccines are about 94% effective when one is fully vaccinated, but there is that small risk that you can still get COVID after, even if you're fully vaccinated. But the important point to note is, if you're fully vaccinated, your risk of getting severe illness, being hospitalized, or having other high-risk complications with COVID is much, much lower. And now there are studies out there that also show that if you're fully vaccinated, and if you are one of those small fractions that get COVID after being fully vaccinated, your risk of transmitting that illness to others is much lower as well.
Excellent, excellent, very good, thank you. So how about this? So what if I got COVID and now I'm all better? So maybe I had it a month ago, 3 months ago, whatever it is, and I'm all better. Do you recommend that I get the vaccine?
Absolutely, because the immunity, there are different strains circulating in our community, so it's quite possible that you can still get infected with other strains of vaccine, other strains of COVID-19. So it is very important that you still get vaccinated after you got COVID-19. Now, the immunity that you get, or your body builds, the protection that the body builds after getting that natural COVID-19 infection doesn't last you for lifelong, right? There is a finite period after which you are still susceptible to get the infection. So yes, absolutely recommend vaccination, even if you've gotten COVID in the past.
Excellent, excellent. Okay, so here's a question from our friends from the Epicenter. What advice do you have, Dr. Kurian, regarding gatherings for meetings, conferences, seminars, etc.? And what would you say is a medium-sized group?
It depends upon.
It's an art, right? It's not a science on this. This is an art. So.
Yeah, it's not as easy to. It's not easy. It's not one size fits all answer too. So it depends upon the number of people who are who are in that crowd. It depends upon whether you are having these meetings indoors, outdoors. It also depends upon, if you're having it indoors, it depends upon the size of the room itself, right? So in general, the higher the number of people, the smaller the space, and not well ventilated, your risk of getting COVID, your risk is much higher.
Got it, got it. Here's another question from our friends from Harmony Public Schools. Can staff that are fully vaccinated, can they safely share an office workspace without a mask?
If you are, and that goes back to one of the charts that I showed in the presentation. So if you're fully vaccinated, you can visit other fully vaccinated folks without a mask.
Excellent, very good. So let's talk a little bit about testing. You know, we don't talk as much about testing as having vaccinations. That was a big deal, to test and then quarantine and stay away and everything else. Tell me, are we still giving tests? Where are we giving the tests? Is it the same site where you can get the vaccine? Tell us a little bit about the testing.
So let me, Ms. Perez, I want to go back to that previous question. Yes, you can. You can share the space with other fully vaccinated people, so long as you don't have anybody considered to be as one of those high-risk individuals, right? Your people with 65 and older, or your folks with underlying medical conditions. So yes, but the other point I want to make also with regards to that is that some of the facilities, some of the employers, some of the businesses are still requiring masking, right? So if that's the case, please abide by your by those rules and regulations. So coming back to where are the testing going on? Testing is still going on. It's widely available in your doctor's offices, all hospital systems. We do have testing sites as well out in the community. And if you need to look at the most recent, where these mobile testing sites are, or the city-owned testing sites are, please visit the COVID-19 portal that we have on our website.
Excellent. So, I am the CEO of the San Antonio Chamber of Commerce. What can I do? What is the number one thing that I can do? Because right now, most of my staff is still working remotely. The goal, of course, is like all of us to get everybody back in the office and get commerce going again. What is the single most important thing you think that I can do to instill confidence in my employees to come back to work?
I think all those, it's not, I think it's a combination of things. You need to make sure that your employees, your staff and your supervisors, they all know how to identify somebody who might have signs and symptoms and how to isolate them promptly. So you should have in your workplace, you should have spaces to isolate any sick employees as quickly as possible. There may folks be still a little bit anxious, especially those high-risk folks. Make sure you have special working accommodations for them. Make sure your employees still can safely, physically social distance coming to work. You have all these strategies in place to reduce the spread of COVID-19 in your place, right, in your workplace. And then also strongly encourage vaccination efforts among your employees.
Excellent. One of the things that's come up that I've heard here, in fact, as early as this morning in anticipation of this event, Doctor, is, so I'm a large employer. I've got some of my employees have been vaccinated, some have not for whatever reason. The protocol to come in the office is, you check your temperature, you sign in and all that. How effective would it be if I created a registry? And this would be one that was, people can sign up for themselves. There's no compulsory registration. But if I self-identified, I'm vaccinated, here's my card, do you think it would be appropriate for them to come in and not have to go through that protocol of measuring their temperature and all that sort of thing? Just as a practice.
So you're saying just let your fully vaccinated folks enter without any screening efforts. Is that your question?
That is correct, yes.
Okay, yeah, you certainly can, but you need to, when you do that, you also absolutely have to make sure your employees know to self-monitor themselves, and should they become symptomatic, should know to exclude themselves or let their supervisors know that they're experiencing symptoms.
Excellent, excellent. Another question from one of our viewers from USAA. Will we need to begin to get a COVID vaccine on a yearly basis?
So that's too early to say. This is a question that that I get asked all the time. So it's too early to say. There is not a good answer for that just yet. The vaccine itself, it hasn't existed for long enough to determine how long the immunity lasts, right? And we also haven't had this virus itself circulating in our community for long enough to determine whether or not they're going to be, strains that would circulate each year, similar to what we see for influenza. So bottom line, it's too early to say, but there are talks about, needing a booster, but those studies are still very preliminary.
Excellent, excellent. And by the way, when you showed the slide about the symptoms when you get the vaccine, and I've been fully vaccinated, by the way, I did have a little bit of pain, but just like any other shot, I get pain, but no other symptoms. I had no fever, no fatigue, nothing. So I was one of the ones that, that the larger group that doesn't have any symptoms. Although I will say my spouse, she was feeling tired and achy the next day. So she was out about 3/4 of that day, just feeling just tired. But the next day she was back up. So she was the one, that smaller percentage that does have some effects, but she's now fully vaccinated and she's feeling great. And so that is a good thing all the way around. So another question from someone: what medical conditions could prevent a person from getting the vaccine? Could you give some examples?
There are some medication. If you're on, so medical conditions is if you have been allergic, if you've received one dose and you've experienced severe anaphylactic reaction, do not go in for that second dose vaccine. Then if you are on certain medications, so if, say for instance COVID-19, you were sick with COVID-19, you were treated with monoclonal antibodies, or you received the convalescent plasma treatment, we recommend you wait for at least 90 days before you come and get your shot, because we are seeing a lot of people showing up at our sites who got treated with these antibody cocktails and want to get a shot. So those we say refrain for at least 90 days. If you've received a live virus vaccine, like your measles, mumps, rubella, that's a live virus vaccine, we say please wait for at least 2 weeks before you get the COVID shots. And if you have any hesitancy or any questions, don't show up to the vaccination sites, please talk to your healthcare provider before you do so.
Excellent, excellent advice. So here's another question. Have any of the recommended protocols, that is cleaning protocols, changed from the beginning to right now?
No, they are still the same. You should clean and disinfect your workspace, your frequently touched surfaces. You can use any any disinfectant that is EPA approved. So I can't think of any guidance that has changed. We say if you have a workspace that's been occupied by somebody who was diagnosed with COVID, we say wait for at least 24 hours before you enter the space and start cleaning, and you can reopen as soon as you clean and disinfect. So the guidance hasn't changed. It is still the same.
Okay, excellent, very good. So here's a question from a friend from Northwestern Mutual. Can the vaccine affect negatively my body's normal protection against new strains?
Can the vaccine affect negatively?
Yeah.
Yeah. So
will it prevent you, or does it hurt you from being safe from the new strains, I guess?
Yeah. So I want to go out and say we don't know much about it, but all I can say is that vaccines are still effective against certain strains or certain variants. More data, as we collect more data, as more people get vaccinated, more data becomes available, we will know. But I haven't heard of any case or any evidence where vaccines made you susceptible to a particular strain of COVID.
Got it. So from our friends from Worldwide Languages, the question is, what happens 3 months after you get the vaccine? So I got the vaccine, 3 months are passed. What happens?
So in terms of immunity?
I suspect so, yes. I think that's what they're getting at.
Yeah. So we are still learning what happens. Now there are studies that say that once you are fully vaccinated, your antibody titers don't fall for up to 6 months. Right now the guidance is 2 doses. We will know more as more data becomes available.
Excellent. So I'll ask this question again. Will I get COVID-19 if I get one of the vaccines?
No, you will not get COVID-19 if you get one of the COVID vaccines that are authorized and recommended at this time, because none of these vaccines have the live virus that can make you sick.
Excellent. I hate to be repetitive, but that is one that I hear a lot, right? And so we want to make sure we're trying to get that myth off of people's minds.
Yes. And along those lines, there are also myths out there about if you get the vaccines, you can test positive for COVID-19. That is not true. If you get the vaccine, it can somehow alter your genetic material, your DNA. That is not true. So there are a lot of myths, and those are all just myths.
Excellent. So here's another question from our friends from Harmony Public Schools again. Of course, now young people that are 16 years of age or older are eligible to take the vaccine. Is Pfizer the only one that they can get, or can they get any of them?
Pfizer, at this time, Pfizer is the only vaccine that is recommended for 16 and older, and Moderna and Janssen vaccines are for 18 and older.
Got it. So Pfizer 16, Janssen and the other one 18 and older.
Correct. There are trials going on for seeing if these vaccines would work in younger age group, 12 years and older, but those are still in the clinical trial phase. So Pfizer is 16 and older, Janssen, Moderna is 18 and older.
Excellent, very good. So another question from our friends from the Epicenter. Do you have a prediction when we might be able to return to large events, or is it too soon to tell? So take a look in your crystal ball here, Doctor.
Yeah, one thing this pandemic has taught me is always expect the unexpected, right? So be prepared. And prediction, it's too early to say. I would say we need to make sure that we are definitely in the downward trajectory. So the focus should be on capitalizing on this downward trajectory, right? Get as many people vaccinated as possible, so the COVID-19 doesn't get a strong foothold in our community anymore.
Okay, so we're getting to the end of the time together. And by the way, thanks again. You have been so fantastic, so gracious, and so straightforward with your answers. So we appreciate that. So last question. Have you seen organizations require individuals to sign waivers? And do you recommend liability waivers for organizations who are hosting events or meetings in person? I know this is maybe getting a little bit out of your comfort zone, but I'll pose the question to you.
Yeah, you're correct. Consult with your legal teams before you do something. Vaccines at this time are voluntary, and we haven't heard of any businesses mandating vaccinations at this time. But like I mentioned in my presentation, should you mandate that, make sure you build in some religious and medical exemptions, and always good idea, consult your legal team.
Excellent. Dr. Kurian, thank you for joining us today. Again, you have been so gracious with your time. You've been so straightforward with your answers. That's exactly what we need, is just straight talk on what this thing is all about, to instill that confidence that we all are craving to get back into something that's much more normal. Can you remind us again, if I want to get on the list to get a vaccine, how do I do that?
So at this time, we are piloting a wait list or a registry for 65 years and older. So like I mentioned, at this time, anybody 16 and older can get a vaccine here in our community. So everybody can get it, but there are still a large segment of vulnerable population that have not been vaccinated. So this wait list is an effort to prioritize 65 years and older, and that system is just being built. It'll be released pretty soon, and when it's released, you will see you will have all the information on how to get onto that wait list. Now, if you want to get onto the appointment scheduling systems, our registration portal for Alamo Dome is up on our website. We just released 3 weeks worth of vaccine, so we don't have any more new online registration slots available until May 1st, but we do have 311 slots available for our folks who are digitally challenged. They can call 311 and still get appointments. And other mass vaccination hubs, just visit their website. University Health System has the registration portal on their website. WellMed has a phone number on their website to call to get the vaccine appointments.
And what about the texting opportunity, the vaccine or vacuna? Remind us about that one more time.
So the texting, all it does is alerts residents anytime any of these 4 mass vaccination hubs are releasing appointments. So today I got a text. I have opted in just to see how it works. So University Health System released a big chunk of appointments. If you are opted in by texting vaccine to 55000 or vacuna to 55000, each time appointments are being released, you will get a text alerting you that appointments are being released.
All right, well, very good. Well, again, You've been very gracious with your time. Thank you for your commitment to this community. You and all your team at the San Antonio Health Department. It's refreshing and it's confidence building for all of us. And so with that, I say I appreciate your time. Keep up the good work of taking care of us. It's making a difference, and together we're gonna beat this vaccine. But we need to continue to wear masks. We need to social distance. We need to, of course, use hand sanitizers. We just need to be smart. And that's the goal here, and the theme is to be smart about your health and what you do.
Thank you, sir. And thank you for working with us. We could not have done this without the wonderful residents and our people here in the community. Thank you for heeding our public health measures and recommendations that we've been making. Thank you.
Thank you. And with that, everyone, we say thank you for joining us. This is being recorded, so we'll put it on our website. You'll be able to come back and take a look at another time. We'll have all the links there so that you can get the toolkit, the information on, the protocols and all that. So you will have everything that you need to be successful in your reopening of your business. And with that, on behalf of our partners, the other chambers of commerce in San Antonio, the San Antonio Health Department, the city of San Antonio, we say thank you for joining us. Good luck and stay safe. Bye-bye.